Gotta find me an angel.
You're listening to the Life After Loss podcast. This show is a safe place for angel moms and angel dads who have lost a child. It's a safe place to share, cry, celebrate, and connect to a community of parents who have experienced grief and gotten through it. Here's your host, Darcia Handy.
Angel moms and dads and everyone who's joining us all over the world, thank you so much for joining us for this episode of our Life After Loss podcast. Today, I have something very serious that I want to talk about, which I say that often, you guys, and it's true. I do feel like the shows that we bring to you are very, very important. Food for your soul, and they help you heal in the loss of your pregnancy and infant loss awareness. But today, one thing that we're doing here at ShalettaMakesMeLaugh.com, all of my partners, all of my family members, podcasters, we're actually talking about COVID-19 right now. And the reason why is because the numbers have gone up so much. It's just very uncomfortable. We're talking about the importance of getting the COVID-19 vaccination. And I'm going to tell you why. Now, my situation is a little bit different. I am a nurse and I am in Texas. And let me tell you something. COVID-19 is not playing with anyone, okay? COVID-19 is taking lives. More importantly, that Delta variant is highly contagious. Highly contagious. Now, and let me paint a picture for you. Where with the COVID vaccine, you could have one person that has the COVID vaccine, and let's say they expose someone to it. If they expose someone to it, if it was 4 or 5 people in a group, maybe only 2 people with the regular COVID-19 vaccine would get it after being exposed. However, the Delta variant is double that number. So if you have that same number of people in a group, and they're exposed to someone with the Delta variant, then it's more than likely that everyone, all of those numbers in that group, would get the Delta variant. Not only is it highly contagious, it is deadly. This is what I want people to understand. One thing that we forget, we're dealing with a virus. Let's go back a little bit. You all remember SARS. Everybody remembers SARS, and we were really, really afraid of SARS because where we saw SARS in other countries, people were dying. The coronavirus is SARS. It is the second SARS, okay? That's how serious it is. The name is different. It is just the second SARS. So it is still very deadly. This is not a joke, people. Wear your mask, get the vaccine. The best protection that you can give to yourself is this vaccine. And let me tell you, it's not just for you. Think about the lives that can be saved just by being careful. You could be saving the lives of your loved ones. You could be saving the lives of your children. You can be saving the lives of colleagues, family, and friends. Or the life you save just might be your own. Now, let me tell you, when the vaccine first came out last year, me as an African-American woman, I said, no, I'm not doing it. I'm not having any parts of it. You know why? Because I felt like the medical community has used African-Americans for guinea pigs for so many years. We remember all the different tests. I won't even go into all of them, but we've talked about it. Not even just the Tuskegee test, not even the test that was done with the herpes, not even that, but even maternity. In areas of maternity, Black women didn't have control over their own bodies. So we know historically that we had a mistrust of the U.S. government when it came to vaccinations, immunizations, or anything like that. We just didn't want to be guinea pigs. That's how I felt in the beginning. But I realized something. Okay, first of all, there's an African-American woman who's contributed to the creation of this vaccine. There are a lot of African-American doctors who stand by the vaccination. So I said, okay, at that time when I did it, it wasn't popular because I got my vaccines in the fall of 2020. But as a nurse, what made me go and get it is I said, okay, I'm going into environments where there are sick people. I'm walking through environments with sick people. They may mask, they may not. I'm walking to environments where I don't know what's going on in this person's life or who they've been exposed to. And then I'm going back home and taking everything that I've been exposed to for the whole day into my home. So I said, okay, the best thing I can do for myself and my family and to lower our risk of getting coronavirus is to go ahead and get the vaccine. And with that, I still continue to social distance. I still continue to wash my hands and use hand sanitizer. And I still continue to use the mask. Now, after I was double vaccinated and people started getting vaccinated in 2021, I said, okay, let's see. I went into the store and I didn't have a mask on. Then the Delta variant came. And this Delta variant, like I've already stated, is highly contagious and deadly. And I started wearing my mask again. I use my hand sanitizer, and I'll tell you about that. Once you use your hand sanitizer 3 times, you need to wash your hands because it's no longer effective. You pump your hand sanitizer 3 times. You've done 3 different things where you clean your hands with your hand sanitizer 3 times. After that third time, you need to wash your hands with soap and water. And then you can continue using your hand sanitizer. One thing I want you all to know about this coronavirus, viruses are hard to cure because what happens with viruses is those parasites and microorganisms, they change. They change very quickly. So they're hard to get a grasp on them and say, okay, we've isolated this as the cause. We're going to make a vaccine to just fight this one particular strain. It changes. That is why we get vaccinated and immunization because it helps our bodies create antibodies. And if we're exposed to it, our bodies can fight it because we already have the vaccine there. So that's why viruses don't have a full cure, but you can definitely protect yourself with this vaccine. Now, we know that the numbers are going up. We have, if you follow me, I have posted all week on social media. There's so much information out there that is incorrect. And I'm so frustrated about it. So, you guys, I'm going to take a moment and I'm going to read something to you, some misinformation that is going around that I just got hot off the press not even 10 minutes ago regarding the vaccine and the numbers, the increase in number in Texas. But let me tell you something. One issue that I have with COVID is the fact that the coronavirus, COVID-19 was made political when it first came out, but we cannot keep hitting on that. Yes, it was made political and it was meant to split the country, and it did for a while. I mean, it really did. But listen, those politicians are vaccinated. Just because they're not telling you that they're vaccinated doesn't mean that they're not. A lot of these politicians are vaccinated, and a lot of them who aren't, they are dealing with COVID, as we have seen right here in Texas. Now, what I want to say to you is in the healthcare community, our fear has been that there are going to be two different types of America, right? Those who are vaccinated and those who are not. However, as I'm reading the newspaper and I'm listening to these politicians, especially what I'm about to say with the article I'm about to read to you, again, some of these politicians are trying to make this black, white, and get our focus off of the real thing here, which is being vaccinated and protecting yourself when you go out in the community. It's not the fault of one race. It's not the fault of one group of people. That's erroneous. That is incorrect. It takes all of us to stop this deadly spread of this virus. There are people who are fighting to not get this vaccine. They're playing on their social media, and then the next thing we know, they got coronavirus and they're being buried, passed away. I lost a cousin to coronavirus, and I said, okay, I couldn't even go to his funeral because we had to social distance. So I was very upset about that. So you know what? And then everybody else who was around him every day, they were in isolation for 2 weeks. You don't want that. You don't want that interruption in your life because you've been exposed to someone who's exposed to someone who's tested positive for COVID. And now you have to isolate for 2 weeks to make sure that you're okay. Get the vaccine, wear your mask, and wash your hands. And by the way, don't wear your mask under your nose. You're not doing anything. This is a virus that attacks our respiratory system. I'm so used to a reproductive system here. This attacks our respiratory system. It goes in right here and through the mouth. If your mask is under your nose, you're not doing anything because it's coming in right here. Wear your mask, cover your nose and your mouth. That's easy. And I know people will say, it's my right. Okay. Let me tell you, I like to wear lipstick. I love lipstick. I have ruined so many masks with lipstick. And let me tell you, even when I take my mask off, I'm like, man, my lipstick is messed up. It's all over my mask. But guess what? I'd rather buy another tube of lipstick than to be in the hospital because I wasn't protected and I got coronavirus from someone. I'd rather just wear a mask and wash it. I'd rather not have any lipstick on and have my mask on. If I do, I'm protecting myself, my child, and my family, and everyone in my household. Now, I talked to you all about misinformation being out there, and I've talked to you all about how one race is being blamed, and I talked to you all about politician statements that are being made that are incorrect. Now, I want to read this article that really has me heated. I'm going to put on my glasses to do this. Do not laugh at my dollar store glasses, but so here's what I want to say. The Texas Lieutenant Governor Dan Patrick ignores facts and blames spike in Texas COVID-19 cases on unvaccinated Black people. This is incorrect. I'm going to read what he said. He said the surge in COVID cases across the country are African Americans who have not been vaccinated, who are the biggest group in most states. That is incorrect. Patrick appeared on a show and he was defending Greg Abbott, our governor's policies on COVID-19 and the backlash that he's received based on it, mask mandates within the school districts across the state. However, we do know that this very past Tuesday, that our governor Abbott tested positive for the virus. And I am reading this. You can read it. It's available. But he is quarantined now, and he's called on all Texans, who's tested positive for COVID to go ahead and quarantine like he's doing. Now, although Patrick confirmed that he laid blame at the feet of he laid the COVID spreading blame at the feet of unvaccinated African Americans. This is what he said, and I quote, Democrats like to blame Republicans on that, Patrick said. Well, the biggest group in most states are African Americans who have not been vaccinated. Wrong. The last time I checked, over 90% of them vote for Democrats in their major cities and major countries. That has nothing to do with anything, okay? This is the truth, though. According to the Texas Department of State Health Services, African Americans are not the driving force behind increased cases. Black residents in the state accounted for 16.4% of the state's cases and 10.2% of the state's deaths as of August 13th. Although the vaccination rate among Black Texans are not very high, we are not the highest demographics. The two demographics with the highest COVID cases in the state are whites and Hispanics. So let's change that narrative right now. Lieutenant Governor Dan Patrick, why? Why are you trying to make this racist? Why are you trying to say, oh, they voted 90% Democrat? Oh, the African Americans are spreading this. We're not. The most COVID cases in the state of Texas are whites and Hispanics. So I beg you with my heart, protect yourself, protect your family. Get your vaccine. The state of Texas is actually, you know how we get the Amber Alert on our phone when a child is missing? We get the Silver Alert on our phone when an elderly person is missing. I received an emergency alert on my phone 2 days ago that was from the state of Texas, and it was about the COVID vaccine. In some places, the state of Texas is giving out a $100 gift card and some a $150 gift card, the Department of Health, for people to get their vaccine. When was the last time someone paid you to get a vaccine? Someone paid you to do something to protect your life. What does that say? The Department of Health in the state of Texas, the Department, Harris County Health Department, this COVID is so bad, and I know I've shared articles on this, so bad in Houston that people are being flown out. A baby got COVID. There was no room in the hospital. The baby was flown out. A mother delivered a baby. She passed away right away. A mother of four passed away. The EMS workers are delayed because of the response to the COVID cases. Nurses are working double and triple shifts, giving vaccines, working in the hospitals. Some nurses are just quitting because they're overwhelmed. And now the Department of Health is offering $100 to $150 just for you to get the vaccine, and the vaccine is free. There's no color on that. There's no Republican, Democrat, liberal, independent. There's no political party on that. When we peel back the mask that we put this facade in front of everyone, we're all human beings. I don't want to bury any more of my friends or family members because of this virus, this coronavirus. I want us all to be as safe as we can. I want our children to be safe. Our children want to go back to school, and they have the right to go back to school, but they deserve to be protected. If you're going to put your child in the school with other kids, we have immunization records already because we're protecting ourselves from other diseases and viruses. This is just going to be one more immunization to add to their shot record. We know that when students go to college, they cannot step foot on a college campus without the meningitis shot. I know that. Last year, my daughter, she was a junior in high school, but she was in college classes. She took the meningitis shot. She had to step on the college campus, and she didn't step foot on it because of COVID. She did it virtual. What I'm saying to you is immunizations and vaccinations are there for a reason. We have to help each other. Let's stop being, I don't want to be insulting. We're informed. You guys, we are informed. Let's stop acting like we're not. Let's get back to being human. Everybody want to get back to things being normal. Let's first get back to being human and protecting our lives. Get the vaccine. It's free. If you're in Harris County, you may get a $100 gift card. You might get a $150 gift card. But at the end of the day, the goal should be protecting your lives and the lives of those around you who love you. Angel moms and dads and everyone here, I really appreciate you all listening. I took a little bit more time than normal, but you guys know I'm a nurse and I just have to get the information out there to you. Correct information. Stay informed, well informed. Make sure if someone tells you something, look it up. Is this true? Does this make sense? If it doesn't, it doesn't. And I'm an advocate. I'm an advocate for eliminating health disparities in minority communities. I'm an advocate for equality in healthcare. I'm an advocate for life. So I'm going to bring it to you real, and I'm going to tell you the truth. And when someone says something out of line, I'm going to call it out. So go out there and get those vaccines, wear your mask, use your hand sanitizer, and wash your hands. Angel moms and dads, I love each and every one of you. I love all of you for subscribing to the podcast, go to ShalettaMakesMeLaugh.com and check out all of our podcast shows. We have some wonderful shows on that platform. I love each and every one of you. Take care of yourselves and each other. Until next time.
You've been listening to Life After Loss with your host, Darcia Handy. Subscribe to the show wherever you get your podcast for new episodes every Wednesday. For more on this program, log on to ShalettaMakesMeLaugh.com.